doctors. Today in our video, let's see about how to make a cardiac diagnosis. Whenever you are about to make a cardiac diagnosis or diagnosis of a heart disease, you have to check for these four things. First, you have to identify the underlying etiology of the problem. You have to see if the disease is congenital in origin, or is the patient is hypertensive, or is the patient is having any ischemic problems, or is there any inflammation. So if there is there can be congenital problems like tetralogy of Fallot or ASD, VSD. After checking all those things, second thing is that you have to check for the anatomical problems, like you have to see which chamber is involved, like is it right atrium or right ventricle, left atrium or left ventricle. Then you have to see about the hypertrophy or dilated cardiomyopathies, so you have to check if there is any hypertrophy of heart chambers or dilation, or if there is both. And then you will check about the valvular anatomical problems. Is the patient is having any regurgitating problems or stenotic problems, for example like mitral stenosis or tricuspid regurgitation, like that. Then for the anatomical problems, you have to also check if there is any pericardial involvement, or you have to also check if there are any changes that usually occur after a myocardial infarction. These are all the things you will check about the anatomical problems. Then you have to check for the physiological problems, like if there is any arrhythmia present, like atrial fibrillation, ventricular fibrillation, or if there is any congestive heart failure or myocardial ischemia. Then finally you will ask about the functional disability. It is nothing but we are checking how strenuous is the physical activity required to produce a symptom. You must have seen the classification provided by the New York Heart Association, the class 1, class 2, class 3, class 4. It says about how much of doing a physical activity the symptoms produced. Like in class 1, even there is no limitation of physical activity. The patient can do the physical activity normally. But in class 2, there would be slight limitation of physical activity. Ordinary activity even can cause symptoms. In class 3, there is marked limitation of physical activity. Even less than ordinary activities can cause symptoms. But when the patient is at rest, the patient is asymptomatic. That is how class 3 and class 4 are different. In class 4, the patient even has symptoms at rest. So, with these four things, you can make a complete cardiac diagnosis. That's for today. Thank you, doctors.